Hi, students, can you hear me? Oh, good evening. Good evening, everyone. Hi, good evening. Can you guys hear me?
Good evening, we can hear you.
Hi, Grace. Good evening.
Good
Hi,
evening.
hi, good evening, everyone. How are we doing today?
You are doing great. How are you?
Oh, I'm doing great too. Welcome to your NCLEX class. I want to welcome all of us to this NCLEX class. This class is our stepping stone to our opportunities. So I'm sure that all of us that are in this class, we are hoping that we are either going to be a United States registered nurse, a Canadian registered nurse, or an Australian registered nurse. So before we start off with what we have today, I want to introduce myself. My name is Instructor Kristen. You can call me Kristen, and I'll be your NCLEX instructor from now onwards. So I welcome all of us today. Welcome everyone, and I believe that we are going to have an awesome class. So today, for this class, what we are going to do is that I want to first of all, introduce us to what exam are we going to write? Do you understand? So now, a lot of people are say that, oh, I want to write the NCLEX, but they don't even know the exam they are going to write. They don't even know how many questions they are going to see on the exam hall. They don't even know, is it going to take 4 hours to finish these questions, or is it going to take 150 hours? So if you know how many questions you're going to see on the exam hall, you can drop it in the chat. So I want our classes are going to be very interactive. If you know the questions, please drop it in the class. If you know how many questions you're going to see, do we know? Or how many hours it's going to take you to finish this exam? Oh, okay. Maria says she doesn't know. All right, that's fine. That's why we are starting with this class. So usually, um um for this class now, what we are going to do is like I said, I'm going to introduce us to this class, right? What are we going to ask? What is expected of us? What are the questions? How many questions are you going to see on that day? What type of questions are you going to experience? That is what we are going to discuss for today. All right. So now, let's start off. We will start off with what is the NCLEX? First of all, what is this NCLEX? Do we know what the NCLEX is? Do we know? Aside from knowing that it's an exam that is going to give you the license to become a United States registered nurse or a Canadian registered nurse, if you know what the NCLEX is all about, please drop it in the chat. Okay, so now the NCLEX is an examination, is a computer adaptive examination. All right, I thought the Zoom will have the whiteboard, but it doesn't have the whiteboard, so I'm just going to be dropping it in the chat. So the NCLEX computer is a computer adaptive test. All right, it's a computer adaptive test. So what do I mean by a computer adaptive test? So in the short form, we can call it a CAT, right? A CAT. That's what we're going to call it. All right. So, Grace says is a standardized exam required for nursing licensure in the United States, Canada, and Australia. That is very, very correct. You got it very correctly. So now, like I said, this NCLEX is a computer adaptive test. What do I mean by a computer adaptive test? The computer is going to test you based on your performance, based on the way you are performing. That is the way the NCLEX is going to grade you. Now, remember that this NCLEX, you're going to use your computer. All right. So now, as you're solving these questions, as you're answering these questions on the NCLEX, now, if you get a question, let's say, for instance, you get question one correctly, it's going to give you a higher question or a more tough question than the one you answered. Now, if you get question two correctly, it will give you a more hard question than question 2. You understand? That's the question 3 will be harder than question 2. Now, if you fail question 3, it will give you an easier question. If you fail question 4, it will give you an easier question. If you fail question 5, it will give you an easier question. Now, in essence, both people that have passed the NCLEX and both the ones that have failed the NCLEX got either 50% of the questions correctly or 50% of the questions incorrectly. Now, the question is, what kind of questions did you get correctly? Do you understand? That is now the question. What kind of questions did you get correctly? Because we have the passing level questions and below passing level questions. All right. So I forgot to say, for our classes, you need to have your jotter. Okay, you need to have your jotter and you need to have your pen. Now, for these classes, the content, you already have your content on the website where you're going to go and read and get all the details. Now, for this class, we are going to be focusing on the NCLEX. What are those need to know? What are the NCLEX test taking strategies? Now, when we are going to discuss system by system, when we bring out one topic, we are going straight to the point. What are those need to know? What are those questions under, let's say, for instance, hypertension? What are those questions under hypertension that the NCLEX usually asks? So this class is not about giving you what you already have, because you already have the content. So you have to make out time to go to the website and read the content. But for this class, you need to have your jotter and your pen that you will use to take notes. Is that understood? Do we understand that? Okay. So that for your jotter,
Yes.
okay, beautiful. So that you can always go back to those jotter to review. Okay, jotting is very, very paramount. All right, so like I was saying, let's go back. Okay, if I'm too fast, please let me know. Okay, I can always rewind. Okay, all right, so let's continue. Now, what did I say? I said that we have the passing level questions and we have below level passing level questions. Now, you can see some people after the exam, they will say, oh, this exam, it was so easy. It was very easy. I wrote, but maybe when the exam comes out, they fail. It's not like they didn't try, but what kind of questions did you get correctly? Okay. Remember that I told you that when you fail, it gives you an easier question. When you fail that one, it gives you an easier question. When you fail another one, it gives you an easier question. So in that row, you will see that that person has failed like 4 questions in a row. And you see in that row, that person is going below passing level. Do you understand? That person is going below passing level, and before you know it, the person has failed. Do you understand? So now I always encourage students that you don't have to get like 3 questions in a row fail. You don't have to fail them. You don't have to get them wrongly. Okay, when you get 3 to 4 questions wrongly, you are not going below passing level. Okay, so at least 2 questions in a row wrong. So if you get 2 questions wrong, you get 3 and 4 right. You feel another one, 2 questions wrong, you get the other one, 2, 3 right. You feel that way you are going, you will be above that borderline. Okay, because there is a borderline. Imagine the L shape. Now there is an L shape, and now there is a horizontal line at the middle of the L shape. Now that horizontal line at the middle of that L shape is the borderline. Now a curve above that horizontal line is above passing level. A curve below that horizontal line is below passing level. So are you seeing it? So now the person that still got below passing level got questions, 50% of the questions correctly. But the only difference between the person that failed and the person that passed is that the person that passed got the passing level questions. Do you get it now? So now, for this NCLEX, we are going to be focusing, for this class, we are going to be focusing on the above level questions. What are those topics that the NCLEX are going to ask you? What are, in those topics, what are the questions? So we are going to extract the questions from each topic. We are not going to dwell so much on those topics. That is why if we print out a timetable and tell you this is what you're going to read, this is what we have for the what we're going to be discussing for this week, I expect you to do your homework, go and read the content on the website, so you're going to come prepared. So our classes are discussion classes. All right, they are discussion classes. We are here to discuss, and I'm not here to give you what you already know. I am here to give you those NCLEX tips. Do you understand? Do we get how the NCLEX is now? Now, before I go ahead and ask this question now, I want to ask you, no, I want to go ahead. For the NCLEX, you're going to answer a minimum, a minimum, a minimum of 85 questions. Okay? A minimum of 85 questions. And then you're going to answer a maximum of 150 questions. So, like I mentioned, is a computer adaptive test. So now, a nurse can be solving a question, and get to question 85, and the computer is like, yes, this is a safe nurse. This nurse has done her assignment. The computer will shut down. Okay, it will shut down. So, like I said, a minimum of 85, a maximum of 150. The the computer can still get to 85 and say, no, this person, they did not even try at all. This person needs to go back. This person needs to go back and read. It will still shut down at 85. Now, once it gets to 85, it can shut down at any number till 150. So once you get to 85, it can shut down at 86, it can shut down at 85, it can shut down at 86, it can shut down at 87, 88, 89 till 150. So it's a pass or fail. Okay, so the person that passed at 85 is not better than the person that passed at 150, just that the person that passed at 85 did excellently well. All right, but they don't write it in the result. The most important thing is for you to pass, whether you pass at 85, whether you pass at 150, whether you pass at 90. Like, I have a student that recently passed at 93, so you can pass from 85, 86, 87 to 150, and then you have 5 hours for the 150 questions. Okay, you have 5 hours for the 150. So in between that 5 hours, you're going to be given two breaks, two break periods. Okay, so two break periods. The first break is going to come after 2 hours. Okay, after you must have answered questions and it has gotten to 2 hours, the computer will give you like a prompt if you want to go for your break. So it's either you accept or you decline. But even if you go for your break, your time is still counting. Those two breaks are all in the 5 hours. So if you like, go for your break and decide to spend 1 hour there, it is still part of your time. There is no extra time. So the 5 hours is with the two breaks. So now the computer can prompt you to go for your break at the 2 hours, and you're like, no, I'm still charged up. I'm not pressed. I want to go. I want to just go. So that doesn't mean that you cannot go for a break if the computer doesn't prompt you. Okay, you can decide to go for your break. So for students that are going above 85, so once it gets to that 85, because there's this thing that there's this will I call it anxiety that comes when the computer doesn't shut off at 85. But even if the computer doesn't shut off at 85, it means you're still in the game. It means that you're doing well. Okay, so now if the computer doesn't shut off at 85, does not mean you should start panicking. Oh, why hasn't it shut down? No, your prayer should be that this computer should only shut down when I have passed. If I have not passed, let this computer not shut down. Okay, do you understand what I'm trying to say? Do we understand now? Do we understand what the NCLEX is all about? So how many
Yes, we
questions in
understand.
total? How many questions in total are you going to answer for the NCLEX? Let me take all that.
You said between the minimum is 85, max is 150,
Okay.
and for the time range is 5 hours, with 2 break period, if I got it right.
Beautiful. That is very, very correct. So for you to know the exam, for you to get appropriate preparation, you need to know what you're going in for. Okay? You need to know the kind of exam you're going in for. Do we understand the computer adaptive? Do we have any question concerning the computer adaptive test? Any question concerning the computer adaptive? So what did I say is a computer adaptive test? Since we all understand. Okay, so far so good. So in one sentence, what is computer adaptive? In one sentence, what is computer adaptive test? United States registered nurses. Do we understand? Do you understand? I want to be sure that you understand what I mean by a computer adaptive test. Do we understand? So Grace said, so far, so good. Thanks. Okay. So I'm sure that we all understand what I mean by a computer adaptive test. So now let's go ahead to the kind of question that you're going to see, the question types you're going to see. So on the NCLEX, there's what they call the said it's a type of exam that uses a computer to adjust the difficulty of questions in real time based on a test taker's performance. That is very, very correct. Great. That is beautiful. That is very, very correct. Now, let's go ahead. Now, for the NCLEX, there are different types of questions you're going to encounter. Now, in 2023 April, the NCLEX introduced another pattern of setting the question known as the next generation NCLEX. Okay? Next generation, next generation NCLEX. And we call this the NGN. So if you go to your Q bank, you will see where they will write the NGN. Okay, so this NGM means the next generation NCLEX, and this next generation NCLEX was introduced in April 2023. Okay, before the total of the exam used to be, I think, 254, and the minimum used to be 75, a minimum of 75 and a maximum of 200. Okay, so but in April 2023, they introduced this next generation NCLEX, and it is good. So now this next generation NCLEX, it comprises of different kinds of questions. Okay, so on the NCLEX, you're going to encounter different questions. Even as you're solving your Q bank now, you're going to see different questions. One is the multiple choice. We all know this one. The multiple choice question. So now the multiple choice, oh sorry, this is multiple choice. Okay, it's choice. All right. So now the multiple choice question is when they give you a question and then you have to choose between A, B, C, D, E. You just have to choose one option. Okay? Is that correct? That's multiple choice. We all know this one. Then there is another type of question known as select or that applies. Select or that apply. Now, select all that apply is also a multiple choice question, but you get to choose more than one question, more than one option. Do you get it? So, in multiple choice, the difference between this multiple choice and select all that apply is that in multiple choice, you get to choose only one option. Okay, but in select all that apply, you can choose more than one. You can choose one, you can choose five, you can choose four, as far as you know that these are the answers. Now, for instance, you can be given a question that says which of these are the side effects of lisinopril. Okay, so lisinopril is an antihypertensive. Okay, it's an antihypertensive under the drug category ACE inhibitor. All right. So when we go ahead, you're going to see all of this. So lisinopril is an antihypertensive under the category ACE inhibitor. And the side effects are hyperkalemia, which is increased potassium level, dry cough, tachycardia. It reduces the heart rate. It can cause hypotension. Now, on the options, they can put high blood pressure, hypotension, hypercalcemia, hyperkalemia, tachycardia, bradycardia. They will not tell you to select all that apply. So in that option, I already know the side effects. I know the content. So I will choose hypotension. I will choose hyperkalemia. Then I'll choose tachycardia. I've chosen three options. So I'll click on it. 1, 2, 3. I will choose those three options and I will move on. So that is the select all that apply. Now, for the for this select all that apply. Okay, please, once you log in, can you mute your mic? Please log in and mute your mic. All right. So now for this select all that apply and in some of the NGN questions, there's what we call the negative marking. Okay, the negative marking. So now the negative marking is where the NCLEX marks you based on your performance and they mark you down. Now, remember that I chose three correct options. Okay, I will get 3/3. Now, imagine I can choose two. If I'm only sure of only two options, I will choose. Imagine that I'm only sure of hyperkalemia and hypotension. I'm not sure of tachycardia. I will choose only two. I'll still get 2/3. Now, imagine that I chose hypotension, hyperkalemia, then I'm now like, is it tachycardia or bradycardia? Is it tachycardia or bradycardia? Then I chose bradycardia. Remember that the correct option is tachycardia, but I chose bradycardia. Now, I have chosen two correct options and one wrong option. So what the NCLEX will do is that they will minus one from your correct option. So remember, now imagine in a normal sense, I chose two correct, right? And one incorrect, right? It was supposed to be three correct options, but I only chose two correct and one incorrect. In a normal setting, I'll get 2/3. But in the NCLEX negative marking, I will get 1/3. So they will minus one, they will continue to minus one from your correct options for each incorrect option that you choose. Does that make sense? Do you understand? If you don't understand, let me know. Does that make sense? So for every incorrect option that you choose, the NCLEX will minus 1 mark. So now imagine that I'm only sure of uh hyperkalemia. I only chose hyperkalemia. I'll get 1/3. So now I chose hyperkalemia. I'm sure of hyperkalemia. Then I now went to go and choose hypertension. And I chose bradycardia. Only hyperkalemia is the correct option. Bradycardia and hypertension are incorrect options. Now I have chosen two incorrect options. How many marks will I get? What will be my mark in the negative marking? What will I get? Come on now. What will be my mark? Just try.
Sorry, we lost your question. So sorry.
Okay. I said that I chose only one correct option and I chose two incorrect options, right? In the negative marking, remember that in the negative marking, the NCLEX will minus 1 mark for each incorrect option that you choose. Now, I only chose one correct option. Then I chose two incorrect options. What will be my mark? What will be my mark?
It will be
Try.
0.
0.
Yeah.
0. That's the correct option. It will be 0. Did we get that? For the negative marking, the NCLEX will minus 1. Now, let me give another instance. Now, let's say, for instance, they ask me, which of these are the assessment findings that we see in a client that has Addison's disease, right? Now, for Addison's disease is a condition, okay? So in Addison disease, the assessment findings that these clients will have is they will have um, hyperpigmentation. They are going to have increase in potassium and decrease in sodium. So they are going to have hyperkalemia and hyponatremia. Okay. Now, there will also be hypoglycemia. Are you seeing it? Hypoglycemia, hypotension. 5, right? 5 correct. Hypotension, hypoglycemia, hypokalemia, hyponatremia, hyperpigmentation. Now, they gave me this as an option. Okay. Now, they told me to choose the assessment findings. These 5 are the correct assessment findings. Now, they said select order apply. Now, they put hypoglycemia, hyperglycemia, hyperkalemia, hypokalemia, hypernatremia, hyponatremia. Okay. Now, for me, I chose the 5 that are incorrect. I get my 5/5. Now, imagine I chose, I'm not too sure. I choose hyperglycemia. Remember that the correct option is hypoglycemia, but I choose hyperglycemia. Then I choose hyperkalemia, which is the correct option. In general, I chose 3 correct options and 2 incorrect options. Okay, in summary, I choose 3 correct options and 2 incorrect options. In reality, I will get 3/5, right? But with the NCLEX negative marking, what will be my score? 3 correct options, 2 incorrect. What will be my score with the negative marking?
1/5.
5. Yes, that is very, very correct. Did you get it? I choose 3. Remember, the NCLEX will minus 1 from each incorrect answer. I chose 3. I chose 2 incorrect. What would they do? 2 incorrect. Remember, they are minusing 1 from each incorrect answer. They will minus 1. Remember, 3 correct, 2 incorrect. So what they are going to minus from my answers is 2. I got 3 correctly. So they minus 2. So I will get 1/5. Are you seeing it now? Now, so for the NCLEX, yes, 1/5. So for the NCLEX, when it comes to select order apply, I will encourage you, you only select the options that you are 100% sure of because of the negative marking. Even if it is 5 correct and you only know only 3, choose only that 3. Because if you overchoose, you will lose your answers. So that is the problem of nurses or students with select order apply. They get to overchoose. And when you overchoose, your answers, your correct answers are being minused. Okay? Now, so you see some students who also, if it is one that you're sure of, you choose that one. But imagine where there are 7 correct answers and you choose only one correct option. It's okay. I mean, you will get 1/7. But for me, that is not a pass mark. All right, I don't call it a pass mark. Getting 1/7 is more like you overchoose. Okay, but even if it's only one that you got correctly, choose that one. If it's only that one that you're sure of, choose it and go. Okay, 1 is better than 0. All right, but it is very important that you know the content. When it comes to select order apply, that is where your content comes into play. When I mean content, I mean what you have read. Do you attend classes? Do you take note? All right, these classes are very, very important. Sometimes you feel like you come to class, but you're listening. Sometimes what you have listened has been it has encrypted in your subconscious. Okay, and when you see a question, imagine now I've talked about this Cushing syndrome. You might see a question on Cushing syndrome, you'll be like, it's true, instructor Christine, she said there'll be Addison's disease. Sorry, the instructor said there'll be hypoglycemia. She said it.
it's already in your subconscious. So that is why classes are very important. And if the audios are recorded, you can go back to listen to the audios. Always have your jotter here. Okay? So do we understand the select order apply? So select, as we are moving on. So when we move on, I will show you more questions on this. So we have other questions, which is the drag and drop. That is another type of question. Drag and drop. Okay, so when it comes to the drag and drop questions, they will give you like questions, like these questions are, let's say for instance, what is the order of cleaning a newborn's cord? Right? We have an order for cleaning a newborn's cord care. That is a newborn's cord care. We can say wash our hands, put on sterile gloves, take a cotton wool, soak it in spirit. You now go 1 2, clean, swab, 1 2, class, swab again, 1 2, throw it away, take another swab, 1 2. Now this is an order, right? Now for the NCLEX can scatter this order. So the first one will be, you take a swab, put it in the spirit. The second one will be wash hands. The third one will be wear sterile gloves. They will scatter this order. So the NCLEX, the question will now be that you should position these questions in the correct order. So what you have to do is that you will use your mouse, the way you try to highlight something. So you're going to press your mouse and move it. You will drag, let's say the wash hands and wear sterile gloves is in order 5. So you're going to drag the order 5 and put it in order 1. Okay? Then put cotton wool in a spirit is now in order 3. So you're going to drag that 3 and put it in 2. Okay, it's just for you to rearrange. The drag and drop is for you to just take and rearrange. Do you understand this one? Does it make sense? Does it make sense? If you understand, let me know. If you have a question, still let me know. It does, right? So that's that for drag and drop. Then for the main NGN, that is the next gen question. That is where we have the case study. Now, when it comes to the next generation case study, the NCLEX is going to give you a full page case study telling you about a client. And this full case study is going to have 6 questions. Okay? Now, for the NCLEX, you can have a minimum of 4 case studies, and you can have you can even have up to 8 if you go above 85. But if you wrote only 85 and your computer shut off at 85, you will have like a minimum of 4. You can just answer only 4 questions, only 4 NGN, only 4 case studies. All right? Now, for this case study, as we are moving on, as you start solving your NGN, you're going to see what I mean by these case studies. Okay, so for these case studies, the NCLEX is going to give you a scenario. So they can start with a client traveled to the northern part in the US. Then there was so much heat. Then the clients now came into the facility saying that they are having hyperpigmentation, hyperkalemia, hypoglycemia. Then on assessment, the nurse notices that there is 3+ distal pulses. The nurse notices S3 and S4 heart sounds. Are you seeing it? It's a story. The NCLEX will give you a story, a large story, a full page story. Okay, now from that page story, they will now ask you, number 1 question can be, what is the potential diagnosis? They will now give you a list of several diagnoses that you have to choose from. So after choosing that one, so let's say for instance that you picked Addison's disease. The next question is going to let you know whether you chose the correct diagnosis right. The next as you move on, as you press next, the next question will be, the healthcare provider diagnoses the patient of Addison's disease. You will know that you got that one correctly. They will now tell you that what are the potential complications of this, then you have to select them. Are you seeing it? You will select two potential complications. So potential complications, we can pick Addisonian crisis. Okay, is a complication. Addisonian crisis. We can also pick um um Cushing syndrome. All right, now we have picked it. The third question can be, what are the managements of these condition? Select all that apply. Are you seeing it? So that whole case study is going to bear branches, 6 branches, 6 questions. That whole full page case study will bear question 1, 2, 3, 4, 5, 6. Do you understand this? Does it make sense? Does it make sense? If you understand, please let me know. If you don't understand, please ask your question. Okay, beautiful. Now, okay, awesome. Now, we've gotten to the case studies, right? We've talked about that. There is another type of question known as the bow tie question. All right? The bow tie question. I want to understand, does it come in form of multiple choice? Is it the case? The case study will be on one page. Okay, is on one page. You will need to read that question. Okay, after reading the question, after reading the story that the NCLEX has given you. Okay, it's a multiple choice. You have to choose. You don't make you make your own diagnosis and choose the diagnosis from the multiple choice that has been given to you. Yes. All right. Awesome. The next type of question is the bow tie question. Okay, so the bow tie question is literal. You know how bow tie is? It has like in the middle, and then it has like, bow tie now. Bow tie, then just the way it is. So we call it the bow tie question because it is like the bow tie. Do you get that? Now, how the NCLEX said this question is that they will also give you a case study. So this one does not bear branches. It's just a standalone. We can also call it standalone. Okay? So for the case study bears branches. It bears branches up to 6. Okay? Now, for the bow tie question, it is standalone. It is just one question, but it is like in a bow tie. A box in the middle, a box in the middle, then that has 2 branches, 1, 2 by the right, and 2 branches, 1, 2 by the left, just like a bow tie. Okay, so in a bow tie question, the question they are going to ask you is, what is the potential? They will give you a case study. All right, in one page by the left, they will give you a case study that you will read. Then in the other page by the right, that is where they will put the empty boxes, a box in the middle, 2 boxes down, another 2 boxes down. Okay, in the middle, the question there is, what is the client's potential diagnosis? So after reading the case study, you will make a diagnosis. There is an option. Okay, there is an option for you to choose. You will not drag an option. They will give you like 3 or 4 diagnoses. So let's say you say it's Addison's disease. You drag the Addison's disease there and put it in the middle box. The other question by the left is, what are the 2 actions that you will take for the Addison's disease? You will pick 2 options. They will give you options, like 5 options. You will pick 2, drag 1, 2. The right question is, what are the assessment findings that you would do for this Addison's disease? Now, they will give you options. You pick 2 options and you put there. Does that make sense? Does that make sense? Okay, beautiful. Now, for this standalone question, it can be very tricky. Okay, it can be very, very tricky because if you don't Okay, now for the Addison's disease, for the standalone question, if you don't if you don't um how do I put it now? If you don't get the diagnosis correctly, okay? If you don't get the diagnosis correctly, you won't be able to get, you will fail the entire standalone question. Okay? If you don't get the diagnosis correctly, you have failed the entire question. Remember that the question by the left is what assessment finding will you do for this patient? The question by the right is what actions are you going to take? So let's say that the potential diagnosis is hyperkalemia, and then you chose hypocalcemia. So that means the assessment finding that you have chosen is wrong, because each conditions have their own different assessment finding. So you have to make sure you know your content. All right? Is that correct?
Yes. Maybe we can hear from others, but it's clear for me.
Okay. So others, is it correct? If you don't understand, it's okay. You can always ask your question. Beautiful. Beautiful. Now, these are the common questions, these are the common types of questions that you're going to see, okay, on the NCLEX. Now, so for the NCLEX is going to also test you on different categories, about 5 categories, okay? So the first category is the pharmacology and parental procedures, okay? Pharmacology and parental. So, pharmacology and parental is the NCLEX is going to test you on pharmacological medications, on all those medications. So, for each system, we are going to discuss those drugs for each system. Then, parental is those parental nutrition, enteral nutrition, parental nutrition. So, another one is health maintenance and promotion. Health maintenance and promotion. So health maintenance and promotion is the NCLEX is going to test you. Maintenance and promotion consists of maternity and child health. So all those maternity, child health questions, they are under health maintenance and promotion. Reproductive disorders, they are all in health maintenance and promotion. Okay, then the NCLEX will also test you on other basic care and comfort. The NCLEX will test you safety and security. You need to know those safety things. Safety, restraints, fall prevention, chemical prevention, how to prevent falls, incidents reports, medication errors, all of that the NCLEX will test you. Now, the NCLEX will also test you on fundamentals. So your fundamentals is also very, very important. Okay? Your fundamentals is very important. So what do I mean by the fundamentals is very important? So your fundamentals consist of the basic nursing. You know, all those things that you're supposed to know as a nurse, such as delegation. How do we delegate duties? Okay, is also there. Blood transfusion. Do you know the transfusion reaction? As transfusion of blood is one of the basic procedures of a nurse. All right, I know sometimes in some third world countries that they don't even allow nurses to transfuse, but I know in some hospitals nurses do blood transfusion. Okay, in on the NCLEX, blood transfusion is a nurse's scope of practice. That's one of the our procedures. So do you know the transfusion reactions? Okay, medication administration. Do you know the rights of medication? Okay, then pressure injuries. Can you identify a client who is at risk for pressure injuries? Can you identify a client who is at risk for falls? Electrolyte imbalance. It is very important. Electrolyte imbalance, hyperkalemia, hypocalcemia, hypermagnesemia. We are all going to discuss all of this. They are under your fundamentals. So you can see that some people might go for the NCLEX and the questions they are going to see is only on fundamentals. They won't get any medical surgical question. Only fundamentals will be set for them. That is how the NCLEX work. Some people might also go for the NCLEX and they will see more of maternity questions. Some people might go, then they will see mental health. Okay, so that is why it is important that every aspect of the NCLEX is covered before your examination. Every aspect of the NCLEX should be covered before your examination. Is that correct? Do you understand? Any questions so far? If I got it well, we get different questions. Yes, you get different questions. You get different questions. All right, let's go ahead. So the next one is the NCLEX will also test you on identify cues. So now, to identify cues, what I mean by identifying cues is that you can go on the NCLEX, like I told you. You said, if I may ask, what do they base on? Can you rephrase, Grace? Can you rephrase? What do they base on? The questions. Okay, do you mean what type of questions do they set? Is that what you mean? Grace, I'm still trying to get. You said on the questions. Are you asking the type of questions, as in why do they ask different questions? Okay, like I've told you before, is a computer adaptive test. Okay, so they're going to give you different questions. It's going to give you a question based on your performance. Okay, that's why. I don't know if that answered your question. No, you didn't. You can always ask your questions. I just wanted to oh, go ahead, Grace. Always ask your question anytime. Okay? Okay, beautiful. Any other question? We have 10 minutes before the class ends. All right. So now I was talking about identifying cues. So now, if you remember, I mentioned earlier that the NCLEX is going to give you a case study, or they can give you a multiple choice that has a scenario, right? Now, your ability and then ask you to identify the potential diagnosis, right? Now, your ability to say that, oh, they will give you a lab value of, let's say, 120 over a lab value of 180 over 90. So your ability to identify, oh, this 180 over 90 is high blood pressure. Then they will not tell you that the client says that they are very thirsty and they have not been able to pee. So to identify cues, very thirsty, unable to pee, that means they are having oliguria and they are thirsty. You have identified that cues. Then the next thing they are going to test you is, aside from identifying the cue, they are going to also test you in making hypothesis. Okay, so hypothesis. So that hypothesis is now, oh, this client said that they have not peed. Okay, they are having low production of urine, and the client says they are thirsty, and the client is having low blood pressure. This is possible dehydration. Are you seeing it? We were able to identify cues. we are able to make hypothesis by joining those cues together to make a hypothesis and say it is dehydration. All right, low blood pressure plus oliguria plus um poly test, we say that this client is having dehydration. So the next thing is nursing judgment. So now this nursing judgment is now, I have identified that this client has dehydration. What can I do to help this client? Okay, now the client has dehydration. My nursing judgment is that infuse 500 mils normal saline. Are you getting it? I have identified cues. I have made a hypothesis and I've made my nursing judgment. To treat the dehydration, I said that this client should be given 500 mils of normal saline. Are you seeing it? Identifying cues, making hypotheses, and also making my nursing judgment. Did you get that? Are you seeing the NCLEX will test you on this? What is your ability? Were you able to identify cues? Were you able to make hypotheses? And also, were you able to make a good nursing judgment? Okay? The NCLEX will ask you, do you understand this? Does it make sense?
Yes, makes sense.
Beautiful. So we have 7 minutes remaining. I'll allow you to ask me any question you have concerning the NCLEX. Now, ask me your question. So far, so good. What we have discussed. Ask me your question. If you've had any question or if there is a myth you know that someone has told you about the NCLEX, ask now. We have 6 minutes remaining.
My question is, I want to come back with what you answered to the question of Grace about the different questions.
Okay.
Thank you.
Okay. Awesome. So you said the question of if you're giving different questions, if you're going to be asked different questions on the exam hall. So let's say, for instance, that 2 people are going for this NCLEX. Will they be asked different questions? Is that what you mean?
Yeah.
All right. Now, yes, like I mentioned earlier when we started this class, I told you that this exam is a computer adaptive test. Okay. So it gives you questions based on your performance. All right. So the person that is writing together with you might not be performing the same way with you. So the questions they are going to give to the person is different from the one the computer is bringing to you. So they are different questions. I don't know if that makes sense.
Yeah, makes sense. Thank you.
You're welcome. Any other question? Any other question?
I didn't get well on the bow tie. Can you please come back with that a little
Okay.
bit?
Okay. Okay, now, so for the bow tie question, it's just like a bow tie. Okay, like that bow tie in the middle and this. Okay, so a bow tie question will have an empty box in the middle. Okay, now, and it will now have, like, when you're trying to make it, will have like a line, and it will now have 2 boxes. 1, 2 by the right, another 2 boxes by the left. 1, 2. Do you understand that? Now, for the bow tie question, the one in the middle is, they will ask you what is the potential diagnosis. They will give you options. So you're going to choose a potential diagnosis and drop it in that box. Okay, so by the left, they will ask you what are the assessment findings that you will see in a client that has that diagnosis that you have chosen. They will give you options. So you will choose those diagnoses and then you will drop it. 1, 2. You will choose 2. By the left, they are going to ask you, oh, sorry, by the right, they are going to ask you, what actions are you going to take for this client that has this diagnosis that you have already chosen? Remember that they will already give you a case study that you have read, that you use to make your nursing judgment, to say that, oh, this client has hyperkalemia. All right. Now, you will choose those actions from the options. You will choose two. One, two. You will choose from it, just like a bow tie. It looks like literally like a bow tie. Okay. So by the time you start doing your Q bank, you will get acclimatized with all these different types of questions. Is that understood?
Thank you.
Oh. All right. Any other question?
It's just like a kind of clarity.
Okay, go ahead.
Based on the questions your nurse will be having or will be doing, and knowing that it's just adaptive questions based on the computer. Like, do you have a choice of, let's say, normally, like you have section A, section B, would you be able to skip from one question to another, or it's just specifically set for one question, then you go to the next? As in, you can't just skip one, then you move to the other. I don't know if I'm clear on that.
Yes, I understand you. So now you can't skip. You have to answer. It is like the way it is. You have to answer one question before you move to the other. You can't skip. Okay? You won't be able to skip. You answer one question, you move to the other. You answer that one, you move to the other. Yes. Any other question? Or contribution? What have you heard about the NCLEX? Interesting. Okay. Oh, so okay, go ahead, Angie. Ask your question. Do you have any question, Marie?
No.
All right. So we are going to be stopping here for today. So when we come tomorrow, we are going to start with the fundamentals proper. So I'm going to be posting the topics that we are going to be doing under the fundamentals on the group chat. So I hope that we are all in class tomorrow, same time. Okay? Don't miss your class. Did we enjoy today's class?
So
Yeah, it was.
much.
Oh,
It's more
I w-
interesting. And I like the way the style you started with. Wouldn't have been more interesting maybe to start with the real topic than knowing what like the war would look like and how to prepare the guns.
Yes, yes, of course, of course. You need to know what you're going for so that you're going
Yeah,
to set
sure.
up your mind. Okay?
It
So,
was more of like a wake-up call.
of course, it is a wake-up call. The NCLEX is a wake-up call. It's not an easy exam. Okay? It's easy. The preparation is what is hard, but the actual exam is not hard. Okay? So I'm gonna see us tomorrow. So I hope to see all of us tomorrow. Please, no
Thank
skipping of
you.
class. All right. Have an
Sure.
amazing
Thanks.
night. Bye-bye.
Thank you.
Amazing night, you too. Thank you.
Bye-bye. Bye.